All right, let's get right into it. Today, we're going to decode a sound that every single clinician, every first responder absolutely needs to have burned into their memory. This isn't just about listening to breath sounds. This is about spotting a life-or-death emergency the second you hear it.
So I want you to picture this. You walk into a patient's room, and before you even see them, you hear it. A sound that just makes the hair on the back of your neck stand up. What does a true drop everything right now medical emergency actually sound like?
It sounds like this. It's this really high-pitched, almost musical, but incredibly harsh noise. It's the sound of a struggle. It's literally the sound of air being forced through a passage that is dangerously closing off.
And that sound, it has a name: stridor. Now, the clinical definition here is incredibly specific. And for good reason. We're listening for a high-pitched, harsh sound, and usually it's on inspiration. Each piece of that definition is a clue, and together they tell us we're dealing with a major upper airway obstruction.
Look, let's be crystal clear about this. There is absolutely no gray area here. Stridor is a red flag sound. It is an auditory alarm bell that is screaming at you that your patient is in very, very serious trouble. You don't wait and see with this one. So what does that red flag actually mean in real terms? It means the airway isn't going to be a problem. It is a problem right now. And the really scary part? The trajectory is almost always downhill. And a lot of the time, it happens terrifyingly fast.
Okay, so to manage this, you've got to understand what's physically happening. Let's dig into the anatomy of the obstruction. We need to know exactly where this sound is coming from and what's causing it.
You know, the physics here are actually pretty simple, but they're also kind of grim. Think of a whistle. Air is being pulled through this critically narrow tube, only here, that tube is the patient's larynx or their trachea. That turbulence is exactly what creates the high-pitched, harsh sound of stridor. It's a direct sign of a severe physical block.
So, the moment you hear this sound, a list of possible causes should start running through your head. What are the most likely culprits? What are the usual suspects that would cause such a severe obstruction?
Here are the big ones you need to have on your radar. In a kid, your mind should jump straight to things like croup, or maybe that they've swallowed something, a foreign body. For adults, you're thinking more along the lines of anaphylaxis, airway swelling, we call it edema, from things like burns or trauma, and of course, the classic can't-miss diagnosis, epiglottitis. The key is, each of these requires a totally different and immediate intervention.
Okay, but we can actually get even more specific than that. This is where sharp clinical skills really shine. By listening with real intent, the sound itself can give you crucial clues about the location of the problem.
This little chart breaks it down perfectly. If you hear it mainly when the patient breathes in, that's inspiratory, you should be thinking upper airway, so above the chest. If you hear it when they breathe out, expiratory, the problem's likely lower down, in the part of the trachea that's inside the chest. But what if you hear it on both?
Well, when you hear that harsh sound during both inspiration and expiration, that's called biphasic stridor, and that right there is the most ominous sign of them all. It points to a severe fixed obstruction, something like subglottic stenosis, which means the airway is critically compromised in both directions of airflow.
So we've identified the sound, we understand what's behind it, and we can even start to pinpoint where the problem is. What does this all boil down to? What is your absolute, non-negotiable mandate when you hear stridor? This is probably the single most important takeaway from all of this. Stridor is not the disease. It's the siren. It's the flashing light telling you that the patient's airway is failing. Your job is not to treat stridor. It's to rapidly find and fix the underlying cause.
So we'll end with this. The next time you're on a call, in the ER, or on the ward, and you hear that high-pitched, harsh sound, now you know what it means. The clock is ticking. The only real question left to answer is, what's your next move going to be?